here we have a sheep heart, and to tell which side is anterior and which is posterior, you look for the sulci. Remember that a sulcus, singular, is a groove, and on the heart we have two major sulci, the anterior interventricular sulcus and the posterior interventricular sulcus. The anterior interventricular sulcus goes at an angle. So this is the anterior side of the heart, interventricular sulcus dividing the two ventricles. On the posterior side of the heart, we have the posterior interventricular sulcus, which goes roughly straight up and down. And they do connect to each other if you follow them. Other parts of the heart to know on the outside, the base of the heart is up here. The base of the heart is where the major arteries and veins enter and exit. The apex of the heart is the inferior point, down here. On the inside of the heart, we have our four chambers. The lower chambers are the ventricles, and the upper chambers are the atria. Now, running between the ventricles here, we have the interventricular septum. A septum is a wall. So here's the interventricular septum, and up here would be the interatrial septum, even though it's not on your list. To tell on the inside of the heart which is left and which is right, you look for the thickest wall of muscle. The thickest wall of muscle is going to line the left ventricle. So this is the left ventricle, this is the right ventricle. It doesn't matter if you turn it upside down, look at it this way. Thinner wall of muscle, thicker wall of muscle, right ventricle, left ventricle. Once you find the valves, there's a valve right there. If you go above that, you'll find the two atria. So this again is the right side of the heart, this is the right atrium, left side of the heart, this is the left atrium. The valve on the left side, there's part of it here, there's part of it here, that's the bicuspid valve, also known as the mitral valve. On the right side, we have the tricuspid valve. There, and there's a little bit of it there. So these are the atrioventricular valves, valves between the atria and the ventricles. These valves are supported by the strings, called the chordae tendineae, or the tendinous cords. So they really do look like cords, like strings. And they are anchored down here to little bumps of muscle called the papillary muscles. So there's one there. We've got them over here as well. So just find a string, find one of the chordae tendineae, and follow it to the wall of the ventricle, and you will find the papillary muscles. The other two valves, the semilunar valves, are not on your list, but they are not supported by these chordae tendineae. They close due to the weight of blood trying to run back into the heart, so they're not on your list. So again, interventricular septum, right and left, find your valves and you can find your chambers. Ventricles are the inferior chambers, atria are the superior chambers.